Hello everyone, thank you for joining us, and you're very welcome to today's webinar on dry off management and preparing for your drying off with HerdWatch and XL Vets. So my name is Eoin Moloney and I'm the head of the member experience team here at HerdWatch. I'm also delighted to be joined this evening by Kevin O'Sullivan. Kevin is a vet down in Glaslyn Vet Clinic in Bandon in County Cork. And Kevin is also chairman of XL Vets Ireland. So delighted to have you on board this evening, Kevin. How are you keeping?
Not too bad. Thanks for asking me along.
Good stuff. Good stuff. No, thanks a million for joining us, Kevin. So, look, we'll be hearing a lot more from Kevin, everybody, in the next few minutes. He's going to give, or I suppose he's going to explain what to keep an eye out for, when you're preparing your cows to be dried off. Kevin is also going to give some really good advice around body condition scoring as well for, dairy farmers that are maybe using selective dry cow therapy. So if you do have any questions that you'd like Kevin to answer, or if you have any HerdWatch related questions that you'd like me to show you how to do things, in the HerdWatch app, feel free to use the chat facility there. You can pop your questions and queries in there. We're going to leave a couple of minutes at the end of the webinar where myself and Kevin will go through the questions that you're asking, and if we need to do some demo and to show you how to record stuff, we'll certainly do that as well. We also have Chris and Eoin on hand helping out there this evening, so keep your questions coming, and the lads are going to try and answer as many of those questions as they can throughout the webinar. And like I said, myself and Kevin will try and go through a couple of maybe the most commonly asked questions as well at the end of the webinar. So before I do hand over to Kevin, for anybody that's maybe tuning in for their first webinar, or maybe you're new to HerdWatch as well, I'd like to just maybe give you a quick overview, a quick background on the HerdWatch story to date. So I suppose HerdWatch is just a very simple and easy to use app, which allows you to reduce your farm paperwork, saves you an awful lot of time when it comes to compliance and recording the paperwork around compliance. But it also allows you to make a lot more better informed and better decisions on your farm. So since we launched over 6 years ago, HerdWatch has gone on to become the market leading app in both Ireland and the UK. And we recently just surpassed over 13,500 members that are using the app, both here in Ireland, obviously in our other markets in Northern Ireland and across the water in the UK as well. In that time, we've managed to get over 1.8 million animals synced down into our system from all the relevant departments. So Ag Food here in Ireland, BCMS in the UK, and APHIS up in Northern Ireland. So coming up on the 2 million mark in terms of the amount of animals that are on the HerdWatch system. And we also recently surpassed a big milestone of over 1.6 million calves that have been registered using the HerdWatch app. There's also over 11 million records, including the likes of dry cow treatments, other medicine and remedies that have been recorded, weights, breeding, movements, and plenty of other tasks that people were maybe using pen and paper or bookwork to record before that have now been recorded and are backed up securely for our members using the HerdWatch app. So that's what HerdWatch is all about. So what exactly we're going to cover in the next half an hour or so. So in a couple of seconds, I'm going to hand over to Kevin. He's going to spend a couple of minutes taking everybody through some dry cow strategies, telling farmers about blanket treatments versus selective dry cow, the techniques used at dry off time, and also explaining about body condition scoring, maybe in relation to selective dry cow therapy as well. I'm going to take over then again, and I'm going to actually do a little bit of demo and showing people how to record the dry off treatments themselves in the HerdWatch app, and maybe some other treatments as well, and how it links to your breeding and the breeding events you've recorded in the HerdWatch app. And finally, like I said at the start, we'll take some time to answer some questions and queries that have been coming in from yourselves. So as I said at the start, please do feel free to get those questions in, keep them coming. Chris and Eoin will help out as much as possible, and we'll certainly get some questions answered as well at the end. So Kevin, if you're good to go, I'm just going to hand over to yourself there now. I know you have some really good information and slides prepared there to help everybody out. So yeah, if you want to take over, Kevin, and we'll take it on from there.
Perfect. Thanks very much, Eoin. I suppose the first quick introduction. I'm Kevin O'Sullivan from Glaslyn Vets in Bandon in County Cork. I suppose we're an 11 vet practice with maybe 8.5 vets really working on large animals, and I'd say 90% of our large animal work is dairy. So we do a lot of work in this field. I'm also this year I'm chairman of OSullivan, and you saw the logo there for OSullivan. Given that would be one of the training organizations that we're affiliated with that supports events like this. So and it also supports farmer training that are given by the other OSullivan practices. There's 30 of them in the country, and it also we use it to train vets as well. So it's a good resource. So without further ado, I'll read and talk about the dry off management. Really is what we're talking about. And like there's more to the dry period than just shoving up the dry cow tubes. We want, in an ideal dry period, we want really to allow the cow to recover from the previous lactation. So a lot of the times cows, especially this time, they're beginning to get a bit ragged from all the work and walking that they've been doing. So their body condition can be decreasing, and we want, over the dry period, we want them to be able to attain a body condition score of 3 to 3.25 at calving, so that she has the best start for the next lactation. We also want to look at that somatic cell count in them. The somatic cell count generally rises towards the end of lactation, so that's a sign that there's maybe subacute or subclinical mastitis going on. And in this dry period, we give the cow a best chance to rid herself of that infection, and again allow the udder to prepare itself for the next lactation. So there's a lot of regeneration of cells and stuff going on. It's also a great time for feet to recover. So a bit of maybe routine pairing is great at this time of year as well, because a lot of, especially cows down this part of the country, do Friday walking, and their feet can be in bad enough, overgrown, or even maybe gone thin from the overwork. So the next 2-3 months they're not going to be doing much walking. There'll be more time to recover. The pressure's off them. So it's the dry period is really the time this is going to happen. We want, obviously, to prepare for parturition. So we want the cow to be really ready to go, and to have healthy cow and a healthy calf. That's the goal of at the end of the dry period. We want to have the cow ready to hit the ground running and have a healthy calf. And a lot of that is how we treat the cow and her nutrition, and the general husbandry that we give her the cow in this period. And if we get this right, she's going to have good milk production. Her genetics are there. She'll have good milk production. She should have minimal body condition loss in the early stage of lactation. Like every cow is going to have some degree of negative energy balance as soon as she calves. So the more you can minimize that, the better for the cow and for the overall production and fertility later on. So we'll talk about that. So the dry cow therapy, definitely that's the number one thing, and that's the thing we really are doing now. So the goal of it allowed for time for the regeneration of the udder tissues. We're trying to treat existing infections if present in the udder, but also hoping that we're going to prevent new infections that occur during over the dry period. Like it is well known that a lot of the mastitis or increase in cell counts that we get in the first 2 to 3 weeks after calving, or even longer, first 100 days nearly after calving, can be traced back to the dry period. We're trying to prevent any bacteria getting into the udder and causing a spike in somatic cell count at this time. Like it's very much in vogue, certainly in the last 2 years here in Ireland, and Animal Health Ireland are kind of promoting it. But there's definitely a move towards selective dry cow therapy, and I'll discuss why there's a move in a minute. But what we've been doing traditionally is just a blanket dry cow therapy, so where every cow in the herd gets antibiotic treatment at drying off, while the selective one is where we select cows that need antibiotic treatment, and then we select the cows that don't. And the cows that don't, they'll get no antibiotic tube. All they'll get is sealers. So that is very part of the strategy from now on, especially with new legislation going forward. And they're going to kick in Ireland in January 2022. So it's going to banning the use of antibiotics in non-infected cows. So really, like it's we're still going to be allowed to use antibiotics, but we're going to have to demonstrate why. We're going to have to demonstrate that the cow actually needs the treatment. So how would we do that? Well, we're going to have to use maybe a lot more culture and sensitivity, and you demonstrate that this cow is infected with this bug and will need a particular antibiotic to treat it. Really and truly, I don't think this is going to be achievable unless milk recording becomes compulsory. And I think, you're going to need a minimum of 4 to 6 recordings per annum at a minimum to be able to do this properly. Like, selective dry cow therapy is great, but if it's done blind without good records, we're going to be in trouble. The other part of the regulations, as regards antibiotics and that are going to be introduced, is that a lot of the critically important antibiotics are going to be removed from the vets. They're going to be very strictly controlled. Some of them are going to be strictly will be allowed used if it's the only option. But more are going to be removed from our use totally, and they've seen that in the UK. I think 2 years ago, there was some of the dry cow tubes and some of the antibiotic injections have been removed from them already, that they cannot no longer use them, and that's going to come here soon enough as well. So just a quick overview of the blanket dry cow therapy. It's the approach where every cow receives 4 antibiotic dry cow tubes. Plus, a lot of people here have converted to sealers now, and I think it certainly is the way to go. But traditionally, it hasn't always been the way. And at the moment, currently, it should still be used if your herd somatic cell count is greater than 200,000 for any of the last 3 milk recordings. In herds that aren't recording clinical cases, I think you really should be using the blanket cow therapy. There's too much risk, drying a cow off and not treating her if you don't know her status. We also have to use blanket dry cow therapy in cows that are in herds where we have cultured strep A-galactia. Now, A-galactia is a highly contagious bug, but luckily it's very easy to treat. So it's really it is a no-brainer if you find it in your herd, that you should treat all the cows in the herd to try and wipe it out in the herd. And like if you didn't and did a selective dry cow therapy, you allow that bug to spread and causes a lot of problems with somatic cell count. I think if there's any evidence of teeth end damage as well, I wouldn't be recommending selective dry cow therapy. I think that if there's teeth end damage, that we need to be putting an antibiotic up there, because basically the barrier for keeping the bacteria out of the udder is damaged. So if there's teeth end damage, you're going to get more bacteria and you're going to get more infections. So really, you're going to need to put in antibiotics and a sealer to try and keep that barrier for the bacteria coming in. You also need to use the blanket dry cow therapy in herds where there's a greater than 5% recent infection rate, or greater than 2% clinical case rate. Where you're getting outbreaks of clinical mastitis, or your somatic cell count is rising. You see that from your cell check page on the ICBF, that they measure that with every recording. And again, if there's signs of active infection in the herd, I think the best approach is actually to treat it. It's also a good idea to use blanket dry cow therapy if your housing isn't up to scratch. You don't have enough cubicles per cow. Like, the recommendation really is to have, for 90 cows, you should have 100 cubicles. A lot of farms we go to would close to 1 for 1. So in those cases, it's too risky. The conditions are going to be too cramped. There's going to be more infection pressure, and probably blanket dry cow therapy is the way to go. The selective dry cow therapy then is really you're assuming the cow has no infection, and you're just sealing the teeth with a sealer and hope that the cow will handle, won't get infected in the meantime. It's vital that in this case then that hygiene is so important, because if we have unhygienic infusion of antibiotic tubes into these, we're going to carry in antibiotic, or we're going to carry in bacteria with us. With no antibiotic in the other tissue, you're only setting up problems for the cow, either straight away after drying off, or they may not have around the time of calving, and you can get some of these nasty E. coli's starting. So really hygiene, and I'll come back to that, hygiene is a vital part of this. If it's your first time trying doing the selective dry cow therapy, I would recommend maybe just trying the 10 or 15% herd. Make sure that you don't take, I suppose, learn to walk before you run. Just see how it works out for you. Is it, have you got all the practice done right? It would be a disaster if you took on too many and discovered that it didn't work for you. So I think 10 to 15% of herd to start off with. Pick your cows, and we'll talk about that as well. Some cows are selected for non-antibiotic dry off, sealer only. That you really have to go back to your records, and that's where I'm saying the milk recording is vital here. I think the herd has to be doing 4 to 6, 8 recordings a year, and you're really monitoring the cows, and you have to be consistently under the 200,000 at a herd level before you could really consider selective dry cow therapy. Anything over 200,000, then there's active infections going on. The individual cow that you select, I think we can set this bar at different levels. If I was starting off, I would say she'd want to be less than 100,000 all year, never been over 100,000, and never had no clinic case during the year before I put her on the list. And some people, I've noticed in their dairies, they have list their cows printed out and on the wall, and as soon as one gets treated for mastitis, she is scratched off. So by the end of the year, there's a number of cows that have been scratched off, and they would no longer be eligible. So it's just a simple way of making sure that a cow that got a clinic case during the year isn't forgotten. But the best way is obviously recording properly, and that's where HerdWatch will be coming in later on. So that's just the general of what they are. We'll just have a quick do's and don'ts of drying off now. Like drying off, you can dry off cows really if they're producing 9 liters or less. You could dry them off straight away. Just now, if you're producing 12 liters, you probably need to kind of or more. We probably need to reduce their diet for maybe a week, just so that the drive for meat production it doesn't work. The cow's kind of getting mixed messages of whether she should be producing or shouldn't, and it's not good for a somatic cell count either. We mustn't allow the cows to lie down for 2 hours post dry off. That's really just so that the teat end has a chance to properly close over, so that no bacteria can get in. So, we don't want them to be left into cubicles and they could lie down, or even standing in a yard or a roadway might not work, because you get the odd lame cow that'll decide that she'll lie down on it, and she's lying down in very unhygienic conditions. So that's going to cause a problem, especially if her teat end is still open. And one other thing is, if you can avoid it, not every yard is set up to do it, but if possible, don't house near the milking parlour, because every time the milking parlour is turned on, the cows associated with milk let down, and that causes a problem for these cows. So if you're just trying to dry them off, keep them away from the milk parlour is best possible. The procedure then, like you've all done it more often than I would have had, but big thing is to remember, like, it's time that it takes. It takes time. Like, it really does take, a minimum of 5 minutes per cow. So really, like, it's 20 is probably enough to do at a time. That's going to, you're going to be 20 cows if you're using seeders as well and antibiotics. That's 80 tubes, and you have to be 100% clean the whole time for this. So you really there's a lot of concentration, a lot of effort to do it. So maybe just plan for maybe 20 at a time. That's to be 20 per person. Look, you should also, should draft the cows in the morning milking and put them aside and do the drying off later. Don't do it in the milking parlour at the same time as milking is going on. Let them out, clean the parlour. Ideally, if you had the cows' tails clipped maybe in the week prior to drying off, it's going to make your hygiene a lot easier to keep it up, keep the hygiene. You're obviously going to need a lot of, the equipment you need is going to be disposable gloves, and I'd be, fairly adamant that you should be changing them fairly often. They're fairly cheap. A box of gloves maybe €15, and you get 50 cows out of them if you change that for each cow. It's not a huge amount of money. Plenty of alcohol or methylated spirits in cotton balls. Just remember the tubes that some people are, they can be quite thick, especially in cold weather. If you are heating it, the best way is actually them into the house the night before. Don't immerse them in water. Obviously, make sure you have marking spray and a head torch or something like that. A head torch is very useful, especially in the darker parlours. You can see exactly what's going on. You can make sure that your hygiene is up to scratch, and you can see that teeth end a lot easier. And you obviously need a method of recording and good fresh teeth dip as well. So we start off with the clean gloved hands, replace if dirty, thoroughly clean and disinfect the teeth end. So normally what you just you put on a bit of teeth dip and clean with a paper towel the whole teeth. But then when you get down to the teeth end, you really need to be a lot more diligent on it. So you use the cotton pad and the methylated spirits and scrub until there's no dirt on the cotton pad. You follow a regular pattern. There is a process where for people to say you clean the furthest away first and treat in the opposite. You treat the nearest one. Treat the nearest first, then. So you clean the furthest and then treat the nearest. And this basically is just trying to avoid, if you clean the nearest and then onto the front quarters, it's possible that you'll contaminate teeth that you thought were clean with your wrist. So in this way, you can avoid that. But alternatively, what is quite good is actually if you just treat one teeth at a time. So do the washing and the infusion of the antibiotics and the sealer one teeth at a time. So it might be just as easy that way. So, and remember, the antibiotic, it needs to be massaged. It mixes with whatever milk is left in the udder, and it's diffused to the other tissues then. And while the sealer really is puncture repair kit, so it needs just to stay in the teeth only. So you squeeze the base of the teeth and in the sealer and try, you put in the full tube. There's no point in trying to put half a tube into one teeth and half into the other, because there's a danger of cross contamination of teeth then. So when you're finished that, you teeth dip with fresh solution. I think I prefer actually dip rather than spray in this case. Or if you are spraying, make sure you give it a really extra effort to cover the entire teeth. Make sure the solution is mixed properly. And mark each cow will stay and record so that for your records. And again, that's where HerdWatch is going to come in. And allow the cow to stand for 2 hours for teeth closure. And like a clean pasture is fine. Clean lined cubicles is fine. I wouldn't let them into the cubicles for the 2 hours though. So if you could stand them somewhere clean first, and then avoid the yards and roadways. And just for the next couple of weeks, monitor for any signs of heat, swelling, or leakage of milk. If they are leaking, you can reseal them. If that's a problem, because generally a week later the milk will have reduced, and you can just reseal. Just be remembering to be sterile, and it'll work fine. So, what's the length of the dry period? Look, really, you need look at any recommendations is 6 to 8 weeks minimum to allow the recovery of the gland. So, first lactations, the cows, they're still growing. They're not really at their adult weight yet. So, and they've had a tough time. They've been growing and they've been lactating for the first time. So they've been under pressure all year. So it's better to give them a little bit extra time off. So 90 days. So really, you'd probably want to be doing them now at the latest for February calving. The high cell count cows, it's also shown that if you have cows that are high cell count, increasing their dry period by 2 to 3 weeks, it has a huge effect on their cure rates. So it would be a good idea to give them maybe 80 days. And also remember that if you scan cows and they're going culling, don't use antibiotics in these, because there can be quite a long withholding period on it. It's just safer to not to use antibiotics in these cases. They shouldn't really, like the antibiotics shouldn't really be required if there's no mastitis in the others. Anyway, so the persistently infected cows, then really you often get these people are saying what bottle to use on these, but a lot of the cases are, if they're persistent and they have been treated before, there really is only one solution for them. So if they've had more than 3 clinical cases in a lactation, they should be on the list for culling. If they've had high cell counts for a number of lactations, a number of recordings despite treatment, again, I think your Trichotherapy hasn't worked in these particular cows. I would say they should be gone. And age is obviously is an issue. First, second, maybe even third calvers might respond to therapy better than the older cows. The infection can get walled off in the udder and cause the antibiotics to fail. So especially if there's a Staph aureus. Look, the milk records, just keep an eye on your milk records. In Ireland, the ICBF do a great job. Use the reports. It will give you great information on which cows are really you should be holding on to or not. And look, again, I think that you can get a copy of the link here. There's a link. There's a great video that Excel Vets have produced on the physical drying off and what to do, and it's given by Conor Garrity. And you can just register there at Agri Academy. There's also 4 other modules, lameness and pneumonia, coccidiosis, and just general good medicine management on farm. And if you can follow the link there, and they're excellent links, great videos there. So just on the body condition scoring, I'm not really going to go through what we're, how to do it, but it's the reason why is what I'm more interested in. Okay, at this time of year, the nutritional requirements of the dairy cows at their lowest. They're not under much pressure. The pregnancy isn't a huge drain on their resources at all, and they're not producing much. So it's actually a great time to address a body condition score, especially in a low situation. So you should really be looking at your cows now, and if you have thin cows or young cows, certainly you should be looking at their body condition, and if just dry them off early. Make sure you add a dry cow nut and a good quality DMD silage if thin. But is actually a bigger problem is overfat cows. They can cause huge issues, especially around calving time if they're overfat. And if you dry all your cows off at one time, they can be getting added good quality silage. It's very easy for a cow to go from body condition score of 3 to 3.5 or 3.75 over the dry period. So you want to keep an eye on it. So the best way to, if that's the case, you're making sure you're restricting the size of overfat and adding with a straw. And also this is an opportunity to take care of routine husbandry. Your dosing, take your fecal samples, fluke and worm time to be looking at fluke and worms. And the feet, as I said, footbathing and a bit of pairing. Try and get the cow back to optimal health as quick as you can. There is just a look at there's numerous charts in this, but you're looking really for the cow that's 3.25. Too fat, you're going to have poor appetite post calving. She has no real drive for energy. When she's before calving, she's no real drive, so then her stomach isn't ready to take on the huge demands that happen as soon as she starts calving. Lactation is a huge demand, and you get all these metabolic diseases, milk fever, ketose, split, which then again leads on to poor fertility. The thin cows will have poor milk production, they'll have poor quality colostrum, they'll have poor calves. Both sets of cows are going to have lots of cleanings, retain cleanings, and will have fertility issues. So there you go. The tin cows, poor colostrum, placentas, poor milk production, poor milk solids, higher risk of donor cows, and have poor fertility because the ovaries aren't getting enough energy. So even if they are producing eggs, they're of poor quality or poor quality embryos. You get more early embryonic death in these tin cows. Over fat cows, then they have the poor appetite for calving. They also have bigger calves. They're fatter. There's more fat around the pelvis. They have a higher risk of difficult calvings and sections. They're 4 times more prone to milk failure than a normal cow. They're more prone to ketosis, fatty liver, and displacements. And then they have a huge risk of going into a huge negative energy balance, and losing more than a body condition score after calving is an issue, especially a huge issue for production and fertility. So that's really it. That's all I want to talk about. So really, just in summary, the dry period resets the cow for the next lactation. Dry cow therapy is important for production and controlling the somatic cell count. Keep an eye on the body condition scores. We really want them to calve down to roughly 3 to 3.25. Use your opportunity to take care of the routine husbandry. As I said, vaccinations, foot care, and parasite control. Take your samples. That's also going to be affected by the new legislation. And preparation for lactation of 2021 starts now. And look after them right now, and things will be a lot easier for you. So best of luck. I hand you back over to Eoin now, if that's okay.
Thanks a million, Kevin. No, that was really, really insightful. Thanks, Kevin. I think there's some brilliant information there to help people, that are obviously starting to dry off their cows now. So cheers for that, Kevin. There's plenty of questions coming in there. We'll get to them in a couple of minutes. A couple there definitely for you to get you involved on, Kevin. But just want to, I suppose, shift the focus a little bit for the next couple of minutes, everyone. And actually, just as Kevin was saying during his presentation there, is how can HerdWatch step in and help and make the process of recording your dry offs and getting ready to dry cows off a little bit easier. So what I'm going to do now is just going to open up the actual HerdWatch app and do a small little bit of demo, and just to give people a sense of how easy it is to do these things using HerdWatch, maybe compared to the ways you were doing it before. So this is obviously the home screen of HerdWatch for those of you that are maybe new to the app or have never used the app to record, dry cow treatments or treatments of any kind before. We're just going to quickly show you how to actually put in your dry cow tubes, record your dry offs. A question that actually has come in while Kevin was talking there, there was one particular question from Anne, which I can answer now. Anne was asking if you record dry off treatments in HerdWatch, do they transfer over to ICBF? So the answer to that question, Anne, is yes, they do. There is something you need to watch out for when you are recording the purchase record for the tubes, just to make sure they go to ICBF. So I'll show you how that works now. So in HerdWatch, anyone that's maybe seen the webinars before, you're familiar with the orange plus button. It's the add button for the app. Whenever you want to do anything new in HerdWatch, the orange plus button is your go-to starter. So you click on that guy there on the home screen, and it opens up all the options of what you can actually record in the HerdWatch app. Now, if you're drying off cows or recording any medicines or treatments in the app, the first thing you do need to do is put in the medicine or put in the tubes that you're actually using to administer or treat the animals on your farm. So what you need to select here first is your medicine or your remedy purchase. So at this point, this is where I actually put in the purchase record for my dry cow tube. So is there anything that you, just, I suppose, in terms of dry cow tubes, Kevin, that you see on a regular basis? Would Kepravin be probably the most frequent one you see being used?
Yeah, Kepravin is the one. Yeah, Kepravin.
Okay. So we'll just go with Kepravin. So obviously I'm using the laptop here. So if you have bought a box of Kepravin tubes, just a top tip that we have, everybody, as well, is you can obviously on your phone use the scan option there, and it'll open up the camera on your phone. You can scan the barcode or the QR code on the box or on the, of the tubes, which should put in a lot of the information on the tubes automatically for you. Just for this example, I'll just do it the normal way. So you can just type in the name at the top, and it'll find the tubes for us. And I just select that they're Kepravin dry cow tubes, and essentially it's just filling in the details of the purchase. So when did I buy it? So if it's something you bought off Kevin down in Bandon last week, you can just select the date that you bought it. your orange headings need to be filled in for you to save this task and for your compliance recording. So I need to select my unit and measure. So dry cow, it's obviously going to be tubes. And how many tubes did I buy? So did I buy a box of 24? Did I get a bigger box of 200? And where exactly did you buy your tubes? So I just select the vet there now. So the easy one for the dry cow tubes here is how many are each animal getting. So you're going to more than likely select 4 here on your dry cow tubes. Now, here's where it gets really, really important when it comes to your recording your withdrawals and for Anne's question in terms of sending the dry offs to ICBF. So you need to make sure that you have your milk and your meat withdrawals entered here. So as Kevin was saying, it depends on the tube that you use, but generally they're going to range from that kind of 6 to 8 weeks, Kevin, on the withdrawal. Is that what you're kind of looking at generally?
Yeah, but I always look at the box because there's
absolutely
often updates, so I tend not to rely on memory.
Yeah, absolutely. That's a great point, Kevin. And just I suppose another tip that we have in HerdWatch here, everybody, as well. It's more for Irish farmers at the moment, but there's a show withdrawal info here which will give you a lot of the withdrawal information on the medicine. But as Kevin said, it's vital, that you just double check the box. What's the milk withdrawal? What's the meat withdrawal? Is it actually 54 days or is it 56 days? Just make sure you're putting in whatever the recommended withdrawal is on that actual medicine. So I'm just popping in withdrawals just as an example here, but like Kevin said, do double check and make sure you're putting in the correct withdrawals. And you can just select again your prescribing vet. Now, as I said a couple of seconds ago, if you do scan in the medicine, it's going to put in the batch number and the expiry date, if there is expiry dates, automatically on your remedies and your medicines. So I'm just going to select dates here, just go a year from today on that. And if you're still watching, this is the most important thing for the dry cow tubes, to make sure that these events are sent to ICBF. If you're an Irish dairy farmer, you need to select your treatment reason here as just type in dry and select dry off. And that means basically once you've done that, anytime you use those tubes, basically the app will know that this is a dry off event and it can send that event to ICBF for you, which obviously saves you having to log it directly on ICBF. So saves you a big job there. So that's the first job done. It's getting your dry cow tubes in there and they're ready to go whenever you do start recording your dry offs or drying off your cows. Now, another I suppose way HerdWatch can massively help you and make your life easier is if you've been recording your actual breeding events, your serves, your scan results, or if you're in the UK, your PDs into the HerdWatch app as well, because then the app knows exactly when your cows are due to calf. And there's settings in the app then that can give you reminders and notifications prior to calving, to get that these cows are probably ready to be dried off. So you'll probably notice here at the bottom of the screen, I have the watchboard here, and I actually have a two notification symbol here. So when I click into the watchboard, it's telling me that there's 2 cows that are due to dry off at the moment. So I can click in here and it's telling me that these 2 cows are ready to dry off. Now the setting that I have in the app at the moment is to give me the reminder 60 days prior to calving. Now, as Kevin said, if you have, heifers or cows that are under first lactation that you want to dry off a little bit earlier, or if you notice you have cows that have a high somatic cell count, that you want to maybe dry off a little bit further out with 80 days, you can change the setting in the app. I'll show everybody how to do that in a minute or two, so that you can get your reminder at 60 days or at 90 days at 80 days or 90 days rather than the 60 days. But just for this instance, these 2 cows I know need to be dried off, so I can just click on my orange plus button here and actually copy. You'll see that there's a little option here to copy these 2 animals into a cattle treatment. And from here then I can just select my dry cow tubes. So I'm going to click on my Keprevin tubes. And I'll just say that I dried these 2 cows off today. So I leave the date as today is the 10th to the 11th. If it's something you done yesterday, you can obviously pop in there and select the date that you actually recorded it on. Who actually dried off the cows? I'm just going to pick myself. And you can see everything else is already there from the purchase. So it's going to be 4 tubes per cow, and my meat withdrawal and milk withdrawal and obviously treatment reason are there. Next thing, I just select next, and all my 2 cows are already selected here, so I don't need to go searching for them or scrolling down the list or popping in their number here at the top. They're already there, and I can just select save. And that's those 2 cows dried off, sent over to ICBF, job done. So it's actually as easy as that. Now, I think there was another question that I might answer here as well, is what if the cows are obviously getting a sealer as well? How do you select the same cows for the sealer treatment as well as the dry cow itself? So Same thing again, you need to start off by putting the sealer that you're using into the app as a purchase record, so you can't use what you don't have in the app. So from the home screen, I'm just going to go plus, and I'm just selecting remedy purchase again. And I suppose just get some advice off you again. Is there a particular sealer that you recommend or that you see being used more than others?
There's a variety of UbroSeal or BoviSeal.
Yeah, so if I go, we have our Ubro yellows. There's plenty of them there. Even if you just, what was the one I had wrote down here? Is the Sure Seal.
BoviSeal would be one.
Yeah, or BoviSeal. So you can see as I search here, is there Bovi Dip, Bovi? So there's so many options here. I go BoviSeal. It's actually coming in there as a BoviSeal. So there is loads of options here, but the one I know we've used before is a Sure Seal, I think. So I'll just select it. It doesn't matter. Like I said, if you scan the barcode or QR code on the box, or if you have the name there, just type it in off the box and it'll find it for you. Same thing again. You just select the unit of measure. So if it's a normal medicine, you can select your milliliters or your tubes. Is it 200 tubes again? And just supplied by the local vet, and you can just save. Now, that's my dry cow tubes, that's my sealers put in. So as I done a couple of minutes ago, I've actually recorded the dry off for those 2 cows, but I also want to give them the sealer. So how do I find the cows? Really, really simply and really easy to find, to create the sealer treatment for them. So if I just go to compliance and remedies and treatments, I can select on the treatments tab here at the top, and here's my Keprevin dry cow tubes that have been used today and by 2 for 2 animals. So I can once again just check the animals, and same as I did before, I can just click my orange plus button and copy them into another treatment again. And this time I can just select my sealers, and administered by, pick myself again. So if there's a few people working on the farm, you can just select them here, select your dose per animal. Next, 2 animals are already selected here, and save. And that's the sealer treatment recorded alongside the actual dry cow or the antibiotic treatment as well. And it's all been stemmed from me looking at the breeding events, getting that notification from HerdWatch, because I have my server, my scan result in there. The app has been able to send me the notification. These are your cows that you need to dry off. There's a couple of other little things to watch out for here, or things that might help on farm. So within the My Herd section, you have smart lists, and within the smart lists, you have cows not dried. So that will give you an example or a list of the cows that have no dry off event recorded for them. So if you're looking for the cows that you haven't dried off yet, you can pop in here and you can find them really quickly, and you can copy some of them or all of them into, as I said, via the orange plus button. You can use the copy to copy them into a dry cow treatment, or if you're just giving them the sealer or a natural dry off. The other thing I want to show then is, obviously, as Kevin was mentioning, it's if you want to get the dry off reminders a little bit earlier for cows on first lactation or for your high somatic cell counts, from the home screen, you can change your settings, and you can change your watchboard settings here. So you can see that the reminder days for my cows is actually set to 70 at the moment. So if you wanted to get your high somatic cell counts at 80 days, you can just change your setting here. You can change your normal dry cow settings, to 90 if you want your first lactation cows. And what that will do is your watchboard notifications will amend to show you those notifications for cows a little bit earlier, so you can get them dried off in time, to give them that time to heal up, as Kevin said. I might just start popping into a couple of questions here, Kevin. I'm conscious that there's a nice few of them coming in. So there's a couple here that people are asking if you could help them out, Kevin. So I just want to see the first one, I think, has come in from Patrick. Patrick has just asked, hi, Kevin, are weighing scales a good investment for body condition scoring for animals?
Yeah, they are, but you have to, your cow type. So I suppose, like you could have a perfectly good Jersey cross cow and she's struggling to make 550, while you've a Holstein Friesian 700, 750. So it's finding out what is normal for your herd, and what they say the normal cow, which is, if they're measuring kind of an adult weight of a cow, it's the fourth. I think a 4-year-old cow and 100 days in lactation. That's what they kind of use as a base. So yeah, it's just how you use it. So really, the body condition scoring is nearly you can apply to each. Like a lot of herds would have different size cows. It's different size cow in each herd. So if you can just train yourself to do the body condition score, look at the cover meter on tail heads, the short ribs, the pin bones, and the pelvic bones. It's well worth maybe investing an hour on plenty of YouTube videos on it, or even Tagus have produced a couple of good demonstrations and charts on how to do it. But it's probably more foolproof to do it that way. You're taking the cow type out of it. The condition is what you're interested in rather than the weight.
Okay, that's brilliant. Thanks for that, Kevin. We have another question here for you as well from Alistair. Alistair was saying that on their farm they started using selective dry cow therapy 2 years ago, Kevin, and he said cows with an average somatic cell count below 80 were only getting the sealer. He says we are now seeing more mastitis in the final months of lactation with these cows that only receive the sealer. Could this be linked to selective dry cow or something else?
Like, I wouldn't think it'd be linked to the selective dry cow, because you should, if anything that happened over the dry period normally reflects the problem in the first 100 days. So if they're low, if they're dried off low and they're calving down low on somatic cell count, and they maintain a low somatic cell count for the first 100 days, it really isn't linked to dry cow treatment then. So just watch. Maybe what could just be happening is that people get relaxed around the parlor hygiene and practices. Sometimes the tea tipping and stuff gets a bit relaxed, and you can get contagious spread that way. There's lots of other things. Parlors, liners and stuff like that can be getting aged towards the end of lactation. So it's unlikely to be due to the selective dry cow therapy if it's late lactation.
Okay, thanks for that. You're actually proving very popular here this evening, Kevin. The questions they're flying in here. There's another one that's come in from Patrick. He's just asked, where can somebody locate an AI flask for personal straws? Maybe I take Pat is doing his own DIY. He's into breeding on his own herd, even though he has a limousine bull at present.
Look, I imagine that I don't know where that would be. I imagine whoever you're buying the straws off will probably be the best source. I think that's where I go. There probably is, if you got onto your own vets, they probably could source it through veterinary wholesalers, but it's not something I get between the ass, to be honest with you. Okay. But I imagine like Munster AI or Dole or any of these guys will be supplying the kit if you're using their straws, so that you'll be able to purchase stuff then.
Yeah, so just try and maybe talk to your genetic company there, Pat, and I'm sure they'll be able to help you out. We've a question from Richard as well for you, Kevin. Richard says, could mastitis boluses cover for not using antibiotics at drying off on low cell count cows?
Yeah, they're getting popular, and I'm seeing some people quite happy with them, but I wouldn't be. I think if the cow is being selected correctly for selective dry cow therapy, if she's low anyway, I would think that there certainly is no harm in them. We have seen benefits with them without a doubt, but I wouldn't say that I would give the non-withdrawal bolus to a cow and rise my threshold to say that the cow 150 cell count would do if you give them the bolus as well. So like they are. I have seen benefit. I must say I have. But again, like anything, it's if you have a chronic cow, it's a treater anyway, and you're going to get worse, just as bad results with the non-withholding problem as you will with antibiotics. So choosing your animal is probably the best thing.
Okay, super again, patient, Kevin. We've two questions here from Aoife. So the first one is Aoife was just asking about some of the links that you had on one of your slides there. So just to let you know, Aoife, if you're still tuned in, everybody that's live, and it's just for everyone, you're obviously going to get a replay of the webinar tomorrow. So that would, you'll be able to see the links from there. I'm sure we can maybe try and get them up there as well just before the end to show you those links again on the Excel vets in terms of the videos that the lads have created there. Eva was just asking as well, Kevin, what do you recommend for footbaths?
Footbaths, footbath is an unusual one. Like we used to be using antibiotics, but that's not allowed anymore. So you can't get antibiotic in footbaths anymore. So there is, there's copper sulfate is one is quite good. There's products you can get with that to kind of it changes the acidity of the footbath and makes the copper sulfate work at a lower concentration rate, and it works better. There's also kind of proprietary products, that you're talking something like the Provita would have a footbath healthy hooves, and they have a lot of essential oils and stuff. But funny enough, footbathing with clean water and cleaning the feet thoroughly, it actually does quite a good job. If you can keep feet clean, it works. But yeah, I would be more inclined, if you have a problem, you need to go and, if you have digital dermatitis or something like that, you need to do a lot of spraying directly maybe onto the feet, and using the copper sulfate solution. It's probably where you need to go. And the big thing is to do it regularly. You might have to do it weekly to try and get on top of this, or more than that, maybe 2 consecutive lactations. Depends on what your problem is. I'd really probably talk to your vet on that. A lot of us, there's different protocols, so there's a lot of stuff there that we can do. But the one thing that has probably changed in recent years is that we can't use antibiotics in footbaths anymore.
Fair play. Thanks a million, Kevin. So just a couple more questions left to go, Kevin. So there's one from Eoin who's asked, should cows receive straw or hay diet only 48 hours after drying off?
It doesn't really matter. They still have to have access to water. It really is just, I'll be stopping the concentrates. Just trying. Straw and hay isn't necessary. It's not necessary, but I wouldn't be giving them. I wouldn't be filling them up with loads of top quality silage either. So it's just restricted diet for straw and hay. Just give them less for a few days, just so that you're not pushing the milk, and preparing the cow for maybe a week. If you have a cow that is milking 15 liters or more, and she's due to be dried off because its calving is due, you probably need to be kind of managing her diet for the week before you dry her off. Try and just get the pressure off her. So okay. That's using a bit of straw mixed through with silage, maybe might do it.
Fair play. Next question is in from Adam. I think Adam's trying to look for a little bit of help to save a few bob here, Kevin. He's asking, which method of dry cow therapy is more economically viable for dairy farmers, in your opinion, Kevin?
It depends on your situation. If you have a high cell count problem and you decide to go just Selective Dry Cow Therapy, you're going to end up saving money on your dry cow tubes, but you're going to have a big cell count problem, and you're going to be hit with penalties rather than getting bonuses. So economic, and then the other side, there's different tubes that you can use. Or say if you're going down the antibiotic route, I think that the tube that is the cheapest is the tube that is going to work. So I would be stressing using the culture and sensitivity, and pick the right tube for you. We do a lot of culture and sensitivities, and you'd be surprised that there's certain bugs on particular farms that aren't responsive to what we'd expect. So that there really is only 3 or 4 of antibiotics in the dry cow tubes. Cloxacillin, the cephalosporins, and there's kind of the Framacetin. So like you're talking about Uberorade, Kepravin, or the likes of Kepravin, or the cloxacillin bases, the Orbenins or the Bovicloxes. So you really need to know, what the culture and sensitivity is. There's no point in using the cheaper tube if the sensitivity is showing up that it's not going to work. So I think you really just need to work with it. It's probably topical, but go with the science on this one at drying off. I think go with the science is the best thing.
Okay, hope that helps, Adam. Thanks, Kevin. So just switching it over a little bit to the Suckler man for a second. We've got a question from Rodney. He's just asking, hi Kevin, what about suckler cows and drying off?
Look, suckler cows are drying off. It's suckler cows don't have the same issue with the level of production by the time you're drying off. And tubing them really necessary to be honest. I think the main risk with suckler cows is the technique. Is managing that. That's they're treated for they kind of get a milk fever grass tetany type condition at drying off. So make sure that their mineral status is good. Stress on the calves then is trying you can kind of gradually wean the cow by taking the calves away for longer periods if that works for you. But really, I wouldn't be that interested in dry cow tubes in sucklers. I wouldn't be volunteering to do it for you anyway. But okay. I don't think it's necessary. A lot of time it's really for somatic cell counts that we're worried about, and that's not really a problem for the suckler cow. It's more dietary. You can do dietary management. You would be restricting their diet as well if you thought your suckler cow had a lot of milk, their diet. Try and cut it back that way.
Okay, brilliant stuff. Thanks, Kevin. We're nearly there. I think there's just maybe 2 or 3 more questions. So there's one from Tony. Tony's asking, should I do a sensitivity test for high cell count cows which have not had clinical mastitis?
Yes. So when I go culture and sensitivities, there's a couple of different things that I like. In an ideal world, starting next lactation, every clinical case you get, you take and put it into the deep freeze, and the sample will survive for at least 6 months inside in the deep freeze, and you can get it cultured at the end of the year for your dry cow tube. Now, it also works if your standard treatment for clinical mastitis doesn't work. You have a pre-treatment sample that you can take the following day to the lab if necessary. So that's probably might even be the best sample. So a milk sample from a clinical case. What I recommend to our guys is to take the sample before treating, and maybe by the end of the year you can samples in the deep freeze, take them all down to the lab and get them cultured in sensitivity, and that'll give you a kind of a bespoke result for what's going on in your herd during the year. That's where you'd be going. If you haven't that done, what we do here is we say go to your records, pick out three cows. Probably wouldn't be going for your worst cows, but 3 cows that have high cell count, and take a bulk sample. So 4 samples, send them off, and then you use your culture and sensitivity from that. The vital thing about culture sensitivity is always be 100% sterile when you're taking the sample. A sterile bottle and sterile samples. You need to clean the teeth just the same way as we were talking about the dry cow tube. A small little bit of fecal or of dust or from the parlour goes into that milk, and it skews your result, and you'll end up paying for your lab test, but you may get no useful information. So you cannot be too clean when you're taking a sample.
Okay. Nearly there, Kevin. Let me just see. James is just asking, should you put dry off as a treatment reason if you're just using a sealer?
Well, you don't even have to record your sealer. The sealer is not a prescription treatment, so I don't think by legislation you have to record it.
And I think just on that, just to let people know that you can obviously use HerdWatch to record natural dry offs as well. So I'll actually, while we're here, I'll just bring up HerdWatch again just for 2 seconds, just to show everybody that if you're not actually using the antibiotic, but you want to record that the cow has been dried off naturally, you can just, from your home screen, once again select your plus button, and if you scroll along your options here, one of your options here is actual dry off, and you can see in brackets it says natural. So it's a little bit different to where you're using your antibiotic. It's seen as an actual treatment. So for this one, you can just select the date that you dried off, your optional field here to select who actually recorded the dry off. And so it's actually so straightforward, so easy to do. And you can just select your cows here, that you've dried off naturally. So if it's 033, you can just select. It's so easy to find them as well, and you just select them and save. And that's your natural dry off recorded in HerdWatch as well, which will transfer over as well for you to ICBF. So if you're not using the antibiotic, that's how you can record your natural treatment. So quick, so easy to do in HerdWatch as well.
I meant to say on as well that there's Animal Health Ireland it was probably a little bit late now, but there were you could apply to get a free veterinary consultation on your dry off if you met certain criteria. I think you have to be milk. You had to have your levels had to be under 200, and I think you have to be Hard Plus, I think, on ICBF. But if you applied for that, and like if you aren't drying off for another month, there might still be time to get to you go straight to Animal Health Ireland, and you can nominate a vet either in your practice or if they have the training done, or someone nearby if they haven't the training done will do it. But it's free, and they'll go through your records and give you a hand on which cows in your herds are suitable.
Okay. Super. And just, I suppose, just to follow up on that one as well, Kevin, it's a really good point. Obviously, for our Irish farmers that are tuned in this evening, we have that link with ICBF. So if you are, milk recording, those milk records are going to sync down into the HerdWatch app automatically for you. So it's going to give you those, your milk yields for cows, your somatic cell count, that helps you to make the decisions around, like you were discussing there, the dry off event itself then, Kevin. So, that will all sync into the app. You can select you can have a little look at each cow before you're thinking of drying off, and it'll tell you here's what her milk yields are, her somatic cell count is as well. So this helps you to make that decision around drying off as well, and you can see how they're performing. I thought we were on the last question. I think there's two left, Kevin, nearly there. Sean is just asking, Kevin, on your opinion for the length of the dry cow period. I'll be using Selective Dry Cow, but cows are in too good body condition score now, and silage quality came back too good. And I suppose Sean's just concerned about the cows being over conditioned come calving time.
Well, you probably give them the minimum if they're over conditioned, and you probably go to 6 weeks. You can go that short, especially when you're not, if you're going to have a selective dry cow therapy method. So you could shorten the lactation if you think that would be beneficial. But probably the best is to really try and restrict the diet for the early part of the dry period. You really don't want 2 weeks before calving. You really want to kind of push on the feed and try and encourage cows to eat as much as possible, so that their system is ready for the huge influx of concentrates and silage and hopefully grass after calving. So for the first month of the dry period is your best chance of trying to affect over-fat cows. And it's restriction, so you're probably talking about 50-50 silage and straw. If you have a diet feeder, that's easy. May not be quite as easy if you don't, but it still works. But they'll eat when they're hungry. But the big thing is you don't want your cows to be over 3.25 if at all possible. You'll end up with problems with the milk retaining things. You could end up with huge problems with calvings, all the metabolic diseases. Try to, if you have, I suppose, two options: keep milking them so that with less feed, so that they're under more pressure and they're producing milk off their back for late lactation. Probably will work in some cases, or else give them a long dry period of starvation. That's another way of doing it. Okay. Controlled starvation. We want to
controlled is right. Yeah. No, that's brilliant, Kevin. Yeah. Thanks a million. I think we're going to wrap it up there, everyone, with the questions. Look, if there's anybody that's still watching that we didn't get to answer your questions, if you just pop into the app, you can obviously send us a message from there. Look, and one of the team will certainly get in contact with you. So if you do have any questions that we maybe didn't cover between myself and Kevin, feel free to just contact us through the app, and we'll certainly get back to you tomorrow and try and help you out. So just going to start here again. So I just have one or two little things just to wrap us up. So, Kevin, just want to finish up. I suppose thank you, first of all, Kevin, for your time this evening and for all that really, really brilliant advice you've given people. Everyone watching, I hope the advice you've got from Kevin has helped you to, make, I suppose, some better decisions when it's coming to dry off. And look, when it comes to HerdWatch, you can see how easy it is to record these events. You know, get going on the app, get your dry offs recorded, make your life easier. If you have any questions on how to do that or anything else in HerdWatch, obviously just feel free to get in contact. You know, just before we go as well, I would like to just quickly mention we have that our refer a friend scheme as well, that, you know, allows you to avail of all the HerdWatch goodies and the likes of the jacket here I've on, and lots of other things, you know, by referring other people to HerdWatch. So if you think it's something that will work for people, let them know, get them to set up their free account, and you can avail of the credits, be it, you know, money off your subscription to jackets and gear that we have there, you know. So yeah, that's it. Everybody, you'll get a replay reminder as well tomorrow. You can watch the whole thing back. And if you have any questions, get in contact. You can see the phone numbers are there for Ireland and the UK. You know, if you haven't got the new Next Generation app, you know, make sure to just pop into the App Store, into the Play Store, get it downloaded there now. You can see the links are here as well on I think it was Aoife had a question earlier on. So there's the link for the XL Vets and for Kevin's practice down in Bandon, if people want to get in contact. And other than that, listen, thank you very much, Kevin. Once again, thanks a million. We really appreciate it for taking the time this evening. And stay safe, everybody. And yeah, we'll catch up with you all really, really soon in the next webinar.
Perfect. Thanks, Eoin. Thanks, everybody.
Thanks, Kevin. Bye now.